By age 50, nearly half of the adult population will have them, both men and women. However, often an uncomfortable symptom that is closely linked with pregnancy. Dr. Lily Tran of Advanced Gastroenterology and Surgical Associates explains hemorrhoids.
Hemorrhoids are enlarged rectal veins, essentially. Okay, you have internal hemorrhoids, you have external hemorrhoids. Generally, all right, well, first of all, let's talk about what may cause hemorrhoids. Hemorrhoids can be caused because over time gravity, so prolonged standing, jobs that require prolonged standing can cause that because gravity causes blood to pool into these rectal veins. So therefore they become enlarged. For example, pregnancy, okay, can cause that, as well as chronic constipation requiring a lot of bearing down. So it's actually quite prevalent. Despite hemorrhoids being common, only about 30 to 40% of people may be bothered by hemorrhoids occasionally. Now let's talk about symptoms. External hemorrhoids may have a little bit of itching, may have pain. Internal hemorrhoids actually bleed, so painless bleeding with bowel movement usually. The complication of hemorrhoids, especially internal hemorrhoids, obviously is bleeding. And there are patients who bleed on and off from internal hemorrhoids who will end up require blood transfusion. That is the point where you know absolutely that these hemorrhoids must be treated. And generally by that time, they will require surgery. Treatment, most of the time, patient would have already tried over-the-counter medication, and oftentimes they work, okay? By the time they come to us for that, of course, we do thorough exams and we rule out other conditions such as a large polyp that may be sitting there that may be misconstrued as hemorrhoids and so forth. So the bad conditions are ruled out. Generally, I do still like to use medication, medical treatment, but on a longer course of treatment. When once or twice that doesn't work, then I will refer to either proctology or surgery.
For more information on the treatments and surgical procedures available at AGSA, please click the Hemorrhoid Relief story link on our homepage, yourhometownhealth.com.
Another condition also closely related to pregnancy is varicose veins of the leg. Women'sHealth.gov reports that 50 to 55% of all women in the United States suffer from some form of vein condition, from small spider veins to rope-like varicose veins.